Hello, I'm Steve, back here with Dr. Nario for our ongoing series. So today, I get to find out about garlic. So, welcome, Doctor.
Hi, Steve. Hi, everybody. Thank you again.
Okay, so what's the significance of garlic? What's garlic about, a garlic supplement?
Well, Steve, now I decided to talk about supplements. The reason of that is I'm seeing the rise of this specific supplement being used in my patients. And that's why now it's worth talking about. And garlic is one of them. Well, garlic, we all know about of course, the one that we eat, but garlic in a deeper sense, we use that more for cardiovascular effects or even protection for our patients. If you want to know that 61 million sales has been related to garlic alone, and this is just the statistics from year 2000, and now it's been ranked as one of the top selling supplements in the market. And there are actually almost 3,000 scientific papers that have been published to vouch for the effectivity of garlic. And let me give you the common preparations that we always kind of encounter about garlic. One is the powdered dried garlic products. You would see this in your grocery stores. And the active ingredient there is called allicin. And you can find this also in the dried bulbs and cloves in your kitchen. Another one is the aged garlic extract. So these are the ones that you would see in supplements. And the one that's really making the difference with this would be what we call the SAC or S-acetylcysteine. This is the active product that's responsible for the benefit of garlic brings to your cardiovascular system. It's involved in a long-term extraction, and they dilute this in ethanol for up to almost 20 months. Then they dry it for you to use it as a supplement.
Hmm. So, what are the benefits of taking a garlic supplement?
Well, see, the garlic supplement is really just wonderful. People think it's only about all about cardiovascular, but yes, let me emphasize on cardiovascular. Then it lowers down your cholesterol. It actually decreases the plaque, the fatty plaques in your arteries. It lowers down your blood pressure and also helps with obstruction in your arteries in relation to the blood flow. But what other things that garlic brings to the table? One, blood. It decreases the clotting or the platelet function of your blood, meaning less strokes, less heart attacks. And other aspects that garlic is involved with is chemopreventative, meaning it has shown in studies that colon, stomach, and breast cancer incidence are lower for the people who are taking garlic. And boosting the immune system, meaning it relieves cough, colds, runny nose, teary eyes, and any respiratory symptom.
Wow, I'm going to get some garlic. so, so any side effects?
Oh yeah, okay. Well, side effects of garlic really is they'll probably call you stinky. So the reason that when you take garlic, you can probably have garlic breath, or even it can go through your skin and you can smell like garlic. The reason for that is it's a sulfur-based compound, sulfur that's inside. But rare are there major adverse effects or side effects, such as when you take garlic in, you have gastric irritation or anaphylactic reaction or massive allergic reactions that can involve you having a hard time breathing or even skin rashes. Those are pretty rare, but basically, this is a very safe type of supplement to take.
Okay, anything we should be aware of mixing with that? You know, if we're on any medications or taking other supplements, what should be, is there anything we should be aware of in regards to that?
Good question. See, majority of the patients who actually take garlic are the ones who already have cardiovascular problems, the one who had a stroke, the one who had a heart attack, the one who has high cholesterol or high blood pressure. Thing is, majority of the time, these patients are already taking what we call blood thinners. The most common one would be aspirin, and another common one, but probably in this more severe type of stage, would be warfarin, or this is what we call the rat poison that thins our blood out if you have what we call atrial fibrillation or heart problems. The thing here is if you take garlic with the aspirin or warfarin, it increases the bleeding chances of these patients. You will bruise more, you will bleed a little longer than other people. But again, this is the one that we want to emphasize, that you have to be careful with garlic in relation to these conditions.
Well, so that's, I'm assuming that that's because it's thinning the blood more than you want to thin the blood. Is that right?
Yes, you don't want to thin it too much because you can bleed from the brain. If you hit your head, if you hit your joint and it bleeds, it can inflame that joint just because of this preventable condition or a situation that you're just taking a drug that's interacting with your supplement.
Okay. So how much should we take? I think garlic's not that expensive, these garlic supplements, but what's the dosage? What recommendations do you have with that on if I wanted to get some garlic?
Well, yeah, this is different from the garlic cloves that you can buy from the stores. But when I talk about supplements in the market, you can have availability of two types. One is garlic powder. This is recommended to be around in the 200 to 300 milligram 3 times a day intake. And for the aged garlic extract is around 3 to 800 milligrams 3 times a day, or it can be also in liquid form. It could be 1 to 5 mils daily. That's why I just want to emphasize that aged garlic is the one really that have shown to be more effective in clinical studies. That's why if you have a choice if you are going to be getting powdered or aged garlic, it's always the best to get the aged garlic extract.
Wow. All right. Well, thank you, doctor. Great information. And for all of you out there, if you want to see this series or find out more about what we're doing, check out our Fitness for 5 membership, where we are doing this ongoing series on many different interesting topics, from different treatments that they do at the clinic and what they do. And so it's been very interesting. So check it out there if you want to see more of this. So thanks again, doctor, and we'll see you next week.
Well, one more thing. Just want to make sure that everybody understands that the benefits of garlic should be understood as long-term treatment, meaning patients should actually be taking this consistently for a long time when you want to see the effects of it in your blood vessels, when you want to see your blood thinned out real good, and even for the prevention of cancer. It's all about consistency and having it part of your regular regimen. So thank you, Steve, again.
Okay, so you're saying this is a regular habit?
Yes, it should be part of your regular supplementation.
Yeah, I'm not going to just do it for a month. It's going to be a new habit.
No, yeah, if it's something that you can, it's really very safe. And even, eating cloves of garlic would be good.
Yeah, and it's interesting, all the other benefits that you get from it.
Yeah, so being Italian is not bad at all.
Yeah. Okay, well, thank you, doctor. We'll see you next week.
All right, thanks, Steve.